Okay, so we're now going to go on and talk a little bit about the relevant anatomy in relation to manual handling and also a little bit on fitness. So we're talking here about human anatomy and its relevance to safe and effective manual handling in the veterinary practice. So you can see in this picture here, somebody taking the hind shoe off a horse. You know, it is important that you're able to handle animals safely and that you're fit and strong enough to allow you to perform routine patient care and animal care tasks without, undue risk of injury. So if we talk about human anatomy, first of all, a lot of it tends to focus on the back and the spine because back pain is very common and it can be quite severe, so it's best avoided. If you've had back pain, you'll know that this from bitter experience, it's definitely something you want to avoid where possible. However, it's important to recognize that the vast majority of back pain is self-limiting, and while it's unpleasant at the time, it does resolve and doesn't have any long-lasting negative effects on you. So that's just something I want to highlight. While it can be quite bad and very painful, it's unlikely the vast majority of cases resolve uneventfully. However, because it's unpleasant, we do want to avoid it, and it's important to recognize the best way to avoid it is not so much to get hung up on the perfect lifting technique, but to recognize that the stronger and more resilient your body is, the less chance you have of getting injured in the first place, and also your ability to bounce back from injuries is much better. So it's important to recognize there's a large element of personal sort of health and fitness in here. So there's a lot of steps we can take to protect ourselves from injury, which is encouraging. Now, in the notes, I've gone through some spinal anatomy and talked about the vertebrae and the tendons and ligaments and muscles that surround them and the different types. So I'd recommend you go through that. Hopefully a lot of it is fairly self-explanatory, but it will help put this section on lifting into context. Really what we're saying is that your spine is made up of vertebrae stacked one on top of the other. So they're indicated, by the white dots here on the photo. And if we keep those vertebrae stacked one on top of the other, they're very, very strong. They're able to resist compression and rotation and all the other forces that will be placed upon them in normal daily life. If your spine is twisted or bent out of alignment, it's less able to withstand force pressed upon it. That's not to say that twisting or bending your spine is automatically going to cause injury. It's just to recognize that the risk is slightly higher. So our aim when performing lifting or manual handling tasks is, where possible, to keep our spine aligned. Okay, so if you can do it, do it. Now, it's not always possible. You'll know yourself from working with animals, often you have to bend and twist and stoop into awkward positions, and that's just part of the job. But where possible, we're going to try and keep our spine aligned when we're lifting or moving things. And we've mentioned back pain and how common it is. Most back pain is caused by soft tissue injuries, so ligament sprains or muscle strains, rather than damage to the actual discs themselves. You've heard of pinched or slipped discs. Discs are very strong and resilient, and they're unlikely to undergo structural failure in many cases, thankfully. So while the damage can be permanent, the good news is in the vast majority of cases, it isn't. It resolves over time and you can get back. It's just unpleasant while you have it, particularly pain in the lower back. So we tend to associate back pain with overuse or, placing tissues under stress they're not able to withstand, and that gives rise to acute pain, particularly in the lower back. The good news is that in many cases, as I said, it resolves quickly. Really, we're talking about tissues. If you think of, say, tendons or ligaments or muscles, often they're made up of fibers, collagen fibers or actin-myosin fibers arranged in parallel bundles, and they're able to withstand a lot of tensile strength. However, if we do stress or stretch them beyond their failure point, we can get fraying or tearing or damage to the muscles, and that gives pain while the muscle heals or the ligament or tendon heals. The rate of healing depends on the blood supply to the area, so there's quite a lot of variation. Really what we want to do is ensure that we're keeping our tissues within their tensile strength limits. So we can do that in two ways. First of all, by thinking about the type of things we ask our body to do, the stress we place on it. And then secondly, and probably more importantly, preparing our body so that it's able to withstand more normal stress and strain. If we look at injury risk factors, this really highlights the importance of kind of lifestyle, because these are all things that increase the risk of injury. So very heavy weights or loads, poor technique, poor posture, lack of flexibility, strength or training, lack of fitness. Sedentary lifestyles is a huge one. So a lifestyle where we spend a lot of time sitting down, not being very active, only putting their body through a very small range of movement compared to what it's actually able to do. And that's a huge factor. Things like wear and tear and pregnancy are obviously things that can temporarily occur or accumulate over a lifetime. So there's a huge variety of things that increase the risk of injury, but the good news is an awful lot of them are within your power to reduce or minimize. So how fit does a vet nurse need to be? Really what we're saying to people is that, we're not talking about Olympic athletes here being able to run a marathon. If you want to run marathons, brilliant, away you go, but it's not vital for the day job. However, it's important to recognise that handling animals is a physically demanding role, no matter what type of practice it is. People tend to think of, maybe working with cattle or horses as being physically demanding, and that's true, it is, but we're also more likely to have mechanisation to help us. So for example, we may use tractors to move, say, bales or bedding around the yard, whereas in a small animal practice, a lot of the items and equipment as well as the patients are moved manually. So we lift and carry sedated animals or bags of feed or large deliveries around the premises. So regardless of what type of practice you're in, you're going to be on your feet a lot. You're going to do a lot of bending and lifting and stooping and twisting yourself into awkward positions. So just to recognise that straight up, it's not a sedentary job. If you spent the last year studying for the Leaving Cert, for example, or doing further study, you probably haven't exposed your body to the type of stress and strain that will be asked to perform in practice. But the good news is you have time to address that between now and going on work placement. So just some examples. If we take this photograph here of a vet nurse restraining a cat on a table, at first glance you think, well, it's not really manual handling, but if you look more closely, you can see that her hips are partially flexed. She's bending over and slightly to her left, and she's rotating her upper spinal column. So her thoracic spine is rotated towards the patient to ensure that she's in a good position to restrain the animal. So it's important to recognize that handling animals requires you to, twist yourself into sometimes kind of awkward positions and then maintain them for several minutes at a time until the job is finished. So it's important your body is able to withstand that. Likewise, if you look at this person here with her dogs, if we look at how she's sitting, she's in a full squat and she's got full knee and ankle flexion. So again, we'll spend a lot of time squatting down around animals. We avoid kneeling down because if both knees are on the ground and the animal suddenly moves or tries to snap at you or lifts up a leg to kick you, you're not going to get out of the way in time. So it's very important that you're able to squat rather than kneel, and that you're able to get out of a squat quickly. So that's something we'll talk about in the practical session, something you can practice in the meantime. Check and see, can you do a full squat? Can you get up quickly without using your hands? It's really important for your own mobility and safety in practice. And this example here of a vet nurse restraining a foal, again, we can see there's a lot going on. Her hips are partially flexed, so she's performing a partial squat in this instance. Her spine is rotated, so the top half of her body is rotated towards the foal's head. Her knee is also slightly rotated, her right knee. And then if you look at her right shoulder there, she's actually turned her hand right over so that she's able to restrain the foal's hindquarters. And you got to bear in mind as well, you might have to hold the foal like this for, say, 10 minutes while someone gives, say, some intravenous fluid therapy. So it's not only being able to get your body into these positions comfortably, but to maintain them. So it takes a good degree of sort of strength and mobility to do that. So really what we're saying, and kind of the take-home message here, is when you're thinking about manual handling for vet nurses, we're saying use a lifting technique that looks after your back. We're going to go through that shortly. Work on your core strength and fitness. So we're not talking about marathon running or Olympic athletes here, but we are talking about having a strong and healthy and fit core and soft tissue, so your muscles and joints are able to withstand the things you ask them to do. Make sure you're able to move your joints through their full range of mobility. So again, a normal sedentary lifestyle, we tend to, keep our hands in front of us and not move them very much. Whereas actually, if you think about it, your shoulders are able to rotate through a massive range of movement. But if you don't use it, you lose it. So it is important to work on mobility through the full range of movement that your joints can do. And if you want to get aerobically fit, that's very helpful. We kind of rule of thumb is jog or run 5 kilometers, that's 3 miles in just under 40 minutes. So not killing yourself, but at the same time, it's enough aerobic fitness to allow you to work on your feet all day, or to, say, trot up horses for a lameness examination or so on. So it is important that you have a basic level of key fitness that you will carry you through your job and keep you in good health and able to do the job and enjoy it. If you are interested in improving your ability to jog or run 5K, then I recommend the Couch to 5K app. There's several free versions of it. You can download it and it'll take you over a 6 to 8 week period from the couch to basically being able to run 5K without stopping. It's well recommended. Okay, so to recap section 3, we've talked about some of the relevant anatomy and pointed out just how common back pain is, but bear in mind that it usually resolves uneventfully. It's just best avoided. How do we avoid it? We'll talk about lifting techniques in the next section and look at how you can keep your spine aligned. But I think being fit and strong is really important. It's not a sedentary job. Working with animals requires a lot of bending and twisting, and your body needs to be able to do that so that you can actually get out there and do the job to the best of your ability and enjoy it. So it's something to start thinking about now. You're obviously going to learn the skills and knowledge you need to be a vet nurse, but you also need to think about making sure you're in the best possible condition you can be to allow you to perform the job and to enjoy it. So my advice really is to find some sort of physical activity that you enjoy and do it, whether it's Pilates or swimming. It doesn't matter. Just find something that you enjoy and you can fit into your daily routine, and that's really going to help. Okay, going to leave it there for now, and we'll come back in a few minutes and go through ergonomics and what we mean by that. Thank you.